Hello, I'm Kimberly Short, and to begin our presentation, we wanted to start off by giving a bit of background information on dementia care in the U.S. and how those dementia caregiving agencies affect patients in modern day. To begin, dementia is defined as a progressive neurological condition that affects memory, thinking, and behavior, ultimately impairing an individual's ability to perform everyday tasks. Dementia is used to describe a decline in cognitive function severe enough to interfere with their daily life activities. Its symptoms include functions such as memory, thinking, orientation, comprehension, calculations, capacity to learn, capacity to form speech, and ultimately does impair their judgment as well. This only further proves that dementia care is a complex, unique, and specialized practice that merits not only social support, but federal support as well. With Alzheimer's disease being the most common form of dementia, contributing to 60 to 70% of cases, millions of individuals worldwide face significant challenges, not only for those diagnosed, but also for their families and respective caregivers as well. And this statistic was taken from the World Health Organization, updated to 2025. Subsequently, with 6.9 million American senior citizens live with Alzheimer's dementia today, and it is projected that by 2060, the number of elderly diagnosed with dementia may double to 13.8 million. And this statistic comes from the U.S. National Library of Medicine. Neurologically, dementia is associated with the degeneration and death of brain cells. Over time, brain shrinkage occurs, especially in regions of the brain that is associated with memory and executive functioning. Unfortunately, currently there is no cure for Alzheimer's disease and most other forms of dementia. But what dementia treatment does is it aims to slow the progression of dementia and slow down the generation of brain cells, which ultimately improves the quality of life of a dementia patient. The prevalence of dementia is increasing globally, driven in large part by aging populations. According to the World Health Organization, more than 55 million people live with dementia worldwide, and nearly 10 million new cases are diagnosed every single year. As life expectancy increases and the baby boomer generation ages, societies face a surmounting amount of pressure to accommodate the complex and long-term needs of people living with dementia. This demographic shift puts into question the sustainability of American caregiving agencies and the wide range implications for patients, families, healthcare systems, economies, and the overall structure of social services in America. Dementia severely impairs an individual's ability to perform activities of daily living, which in the healthcare industry, this shortens to ADLs. And what ADLs essentially mean is that basic self-care tasks that healthy individuals are able to perform independently. Dementia patients and those with Alzheimer's struggle with doing those tasks due to their disease. ADLs include trouble with bathing, personal hygiene, eating, drinking, dressing, using the bathroom, mobility, safety awareness, etc. These patients may forget to eat, or they may eat too repetitively. They may neglect their hygiene, wander into unsafe areas, or they may be unable to manage their finances or go to their appointments on time. Additionally, patients may also combat the struggles of Alzheimer's with other health conditions. For example, if a dementia patient has any pre-existing health conditions, such as heart disease, diabetes, or arthritis, this would only further complicate their care. Eventually, individuals may become entirely dependent on others, requiring 24-hour supervision to prevent harm and ensure their own proper care. In response to this growing health crisis, caregiving agencies have emerged to offer specialized support, providing professional in-home or facility-based care tailored to the unique needs of dementia patients. These agencies serve as a lifeline for families, offering expertise and relief in navigating the complex progression of this disease. However, the caregiving system for dementia patients is plagued by persistent insufficient support and attention that contribute to modern-day inefficiencies. These include inadequate caregiving training, staff shortages, high turnover rates, and insufficient funding. All problems that trace back to long-standing under-evaluation of elder care work and gaps in public health care policy. As a result, many caregiving agencies struggle to provide consistent, high-quality care, leaving patients and families very vulnerable. It is important to note that not all caregiving services are equally equipped to handle the specialized, unique, and dynamic needs of a dementia patient. Without proper training in dementia-specific accommodations and communication, behavioral management, safety protocols, caregivers may inadvertently neglect or mistreat patients, which further diminishes a dementia patient's quality of life. Dementia, particularly Alzheimer's disease, is an urgent and growing global health issue with profound implications for patients, families, and the overall healthcare system. As populations age and more and more people are diagnosed with Alzheimer's and dementia, the demand for competent, compassionate, empathetic, and specialized caregiving agencies will only intensify. Addressing this needs requires not only an increased amount of resources, but also a commitment to individualized and innovative patient care and public service work.
All right, guys, so my part of this presentation, I'm going to be talking about the statement of problem and the purpose for dementia in people with Alzheimer's. So pretty much it's a functional decline in daily activities. The examples I used, individuals can't even brush their teeth, get ready, make their own meals, which requires some expertise on help on supervision and support for these individuals that fail these type of daily activities. Some issues with it is the fact that there's limitations in coverage from insurance. Medicare only might cover short-term skilled services such as nursing and physical therapy. Also, people with large-stage dementia might require hospice, but it has to be approved by a qualified medical professional such as a doctor. Some implications for healthcare professionals and decision makers. It's sorry, I'm reading my notes. It's a concern because some families, you can't afford it, so they might have to pay out of pocket or take the caregiving in their own hands, which can cause, according to the NCCD, it causes a burden because they have to not only focus on their personal life, but also do the caregiving themselves, which can negatively impact them as well as with the individual with the disease. In 2025, 7.2 Americans over 65 and older will have Alzheimer's. 74% of them are 75 and older. One in 9 age 65 or older have the disease, which is 11% of the population. 2/3 of Americans with it are women. 110 out of 100,000 Americans from age 30 to 64 can have early stage dementia, such as memory loss, mood changes, difficulty on concentration. Pretty much purpose, the Centers for Disease Control and Prevention they pretty much promote knowledge and prevention for diseases such as Alzheimer's. And one of their programs that uses the National Healthy Brain Initiative is it's pretty much their strategies to improve brain health across the lifespan and support at-risk population. And then lastly but not least, an example I found was at Memory Care at Crown Cove. It's pretty much a caregiving care agency, and their mission is to push centered approach to comprehensive memory care, and some of the services they provide is personal care and purposeful engagement. They pretty much strive to support individuals or the residents with living a more enriched, connected life. And that's pretty much my portion of the presentation. So, thank you.
For the scope and limitations portion of this presentation, we primarily aim to focus on the caregiving agencies that are within the U.S. The scope of services offered and the limitations within the caregiving agencies significantly influence the quality of life for dementia patients and their respective healthcare providers. As the prevalence of Alzheimer's disease and related dementias continues to rise across the United States, the role of caregiving agencies has become increasingly critical. These agencies, ranging from local in-home care providers and national franchises, serve as lifelines for families struggling to support loved ones with progressive cognitive decline. However, the scope of services offered and the limitations within the caregiving industry significantly influence the quality of life for dementia patients and their family members. This analysis draws upon interviews with full-time professional caregivers and families receiving these services, as well as readily available data and reports to evaluate and further understand the capabilities and constraints of dementia care agencies in the U.S. according to the National Library of Medicine. Over 11 million unpaid caregiving agencies and patients' family members served an estimated 18.4 billion hours of care and services to those with Alzheimer's. This reflects a major increase in inadequate healthcare systems necessary to care for dementia patients and dementia research. Caregiving agencies that specialize in dementia care play a critical role in addressing the unique needs of patients and their families. These agencies offer specialized services such as memory care programs, trained staff equipped to handle cognitive decline, and supportive resources for families navigating the challenges of dementia. The focus is on the quality of care, communication, and consistency of support provided to ensure both a patient and their respective family members receive an appropriate and compassionate assistance tailored to the unique progression of the disease. A prevalent obstacle within memory care is the lack of accessible agencies. Access to these specialized services is not uniform, which causes patients to have a scarce amount of agencies to receive care from. A key limitation within the healthcare system is the scarce geographic distribution of dementia-focused caregiving agencies. Many cities, particularly in rural or underserved areas, lack facilities that offer unique and specialized tailored memory care or dementia-specific support. This geographic disparity results in limited options for patients and families, often forcing them to rely on general caregiving services that may not be fully equipped to adequately meet dementia-specific needs and standards. As a result, patients in certain regions may face a reduced quality of care and increased strain on informal caregivers.
Hello, Professor Deely. My name is Elvia Penazola, and I am part of Group 13. Our group presentation and report is on how caregiving agencies help people with Alzheimer's and dementia. I am a caregiver, and I have been for over 10 years, and I happen to specialize with Alzheimer's and dementia patients. So this subject is very near and dear to my heart. And I want to thank Lester and Kimberly for helping me with this subject and going along with it since I did choose it. They did a great job. And I'm going to focus on the scope and limitations and methodologies of this presentation. For scope and methodologies, we focused on caregiving agencies within the U.S. and we conducted interviews with several full-time caregivers and families receiving care from agencies. And our research is also based on publications and statistics. So the scope of services offered and the limitations within the caregiving industry significantly influence the quality of life for dementia patients and their caregivers. And there are over 11 million unpaid caregivers and patient family members served an estimated 18.4 billion hours of care for dementia treatment in 2003. We didn't include hospitals or nonprofit organizations. Also, we didn't cover international caregiving models or do a deep dive into government programs. So our research just gives us a snapshot of the U.S. caregiving industry, but not the full global picture. As for methodologies, we did gather information from reliable sources like the Alzheimer's Association, the CDC, and the National Institute on Aging. And we also looked at public data and used charts to show trends in caregiving training, care costs, and the growing number of patients. And most importantly, we included real voices from interviewing two key groups, the frontline caregiving workers and the family members of those receiving the care. And this helped us get a clearer picture of what's working and what needs improvement within the industry. And within our report, I included the interview questions that I gave to both caregivers and the families receiving the care. So those questions for the caregivers, they helped us learn about job training, job stress, how connected they feel to the people they care for. Also for the family members, the responses gave us an insight into what the families are going through and what they need most from these care agencies. As you can see in the methodology page of our presentation, I did include two different infographics. One was on the Alzheimer's disease facts and figures that we got from the Alzheimer's Association, and then another one was the impact of caregiving for these family members and caregivers that just do so much for their family member, and they do not get compensated for their work. So in closing, our research shows that private caregiving agencies play a big role in helping people with Alzheimer's and dementia, but there is room for improvement. By focusing on U.S. agencies and combining data with real-life interviews, we were able to highlight the strengths and the gaps and how care is delivered to these patients. And we give 4 points of improvement. One being improved caregiving training across all care agencies. 2, provide more family education and support resources. 3, offer financial assistance or a sliding scale fees to families to help families pay for care. Also, and last, just raise awareness about caregiving services and options available in the community to help families with caregiving, and especially those that suffer from Alzheimer's and dementia. Thank you.